Hi everyone, I'm Cheryl Butler and you're listening to the Mighty Mommies Quick and Dirty Tips podcast, which will help make your life as a parent a little bit easier and a lot more fun. Welcome. Today's episode is number 354, titled 5 Tips to Encourage Language from Speech-Delayed Children, a topic near and dear to my heart because I had 3 speech-delayed kids myself. As the mom of 8 kids, I've experienced each of my children's developmental milestones in completely different ways and with mixed expectations. For example, both my oldest and youngest, both girls, were early bloomers in everything from uttering their first words to toilet training. Sandwiched in between, I had a son who was rolling over at 4 months, crawling before 6 months, yet he didn't walk until he was at least 15 months old. The point I'm making is that it's not uncommon for children who are developing normally to hit milestones on their own individual timetables. However, milestones are in places for a reason. They serve as guidelines for both parents, pediatricians, and educators to follow, so that if some area of development does seem to be off schedule, they can help get a child back on track or seek further evaluation. One area that 3 of my children did not meet the standard guidelines for was speech-language development. In fact, they were significantly delayed, resulting in several intensive years of formal speech therapy treatment. Because my first child was an early talker, I was surprised when my son, just a year younger than his sister, was using very little language at the same stages. My mother's intuition told me that something was off, despite the advice of many who told me not to worry because boys talk later than girls. While this is true to some extent, I also recognized that he wasn't making the same effort that my daughter had used to express his needs and interests verbally. So I followed my gut and I had him tested at the age of 2. Early intervention is key when helping a child overcome a developmental delay, such as a speech-language problem. By practicing the tips from a speech-language pathologist in your child's everyday play and routines, you can help elicit language consistently during these formidable years. Here are 5 tips that Mighty Mommy learned from the experts on how to encourage language from a speech-delayed child. First, let's talk about language skills prior to toddlerhood. A great resource is the American Speech Hearing Association, known as ASHA. ASHA is a great resource to learn about developmental milestones as well as descriptions of most types of communication disorders. Here are some language milestones for infants through toddlers, which is 18 months, shared on one of my favorite language development websites, playingwithwords365.com. Infants should be babbling regularly between 6 to 9 months of age. Infants should take part in back and forth sharing of sounds, smiles, or other facial expressions by 9 months. Infants should take part in sharing reciprocal interactions like pointing, sharing, reaching, or waving bye-bye at 12 months. Toddlers should be pointing at objects of interest by 14 months. And toddlers typically say their first words somewhere between 9 to 15 months of age. Toddlers between 12 to 18 months should understand the words for common objects and people in their lives, like Baba for bottle, Mama, Dada, etc. Toddlers between 12 to 18 months should be able to imitate simple gross motor movements like clapping hands or stomping feet. Imitation is key to language development. By 18 months, the average child has 50 words in his vocabulary and will start to put 2 words together to form short sentences once he hits this 50-word vocabulary milestone. By 18 months, the average child will be able to answer simple questions. Where is the doggy? And they'll be able to follow simple directions involving common items, get the ball, and point to pictures of common objects in books when asked ball, book, dog, cat, etc. By 18 months, the average child should be able to follow your pointing with his gaze, look at things that you point to, and should be playing pretend with some objects, like pretending to drink from a cup, and should play alongside, not with, other children, also known as parallel play. So here we go. Tip number 1, engaging your infant. Those special moments spent cuddling and gazing at your newborn are not only tender moments, but also wonderful opportunities to engage your baby in language activities. When your baby stares at you, imitate his facial expressions. If he sticks his adorable tongue out at you, do the same back to him. Do this several times and see if he doesn't imitate you and do it back. And repeat the cooing noises that he makes, as well as another way of back and forth interaction. Talk to your baby as you bathe him, change his diaper, pick him up out of his crib, swaddle him and feed him. Any chance you can offer an explanation of what you're doing while caring for him, well, except for 2 a.m, or what might be happening around him, are wonderful opportunities to engage your baby in receptive, and that's when a child understands language. Tip number 2, identify everything. Young children learn language by listening to those around them. The opportunities to describe the world around your baby and toddler are endless. So get into the habit of offering an explanation for everything you do, such as counting the kisses you give her, using names of siblings as they enter the room. Point out colors in the room, such as the pretty blue sky in the painting, or the sofa is brown, the kitty is gray, mommy's shirt is pink. Build on the skill of imitating by teaching your baby to play peekaboo and pat a cake, waving bye-bye, and shaking your head yes or no. Remember to communicate about all the things you see in her environment. When she points at things, talk about them. Tip number 3, expand on playtime. One of the best tips I learned from the first speech-language pathologist that worked with my son was to use playtime to expand on language opportunities. My son loved playing with cars and trucks. In fact, he said the word car before he said mama. Her advice was to get down on the floor and label everything that was happening during his playtime with the cars. You have 3 blue cars. Your truck is red. Your car is going to the store. We can buy milk at the store, and so on. We did this over and over and over again for weeks and weeks on end, and then he suddenly started repeating the words and eventually using them on his own when he played. The reason this was successful was because it was something that interested him, playing with his toys. We took full advantage of building on his language by following his lead and engaging in labeling, describing, being enthusiastic, and basically being consistent by talking to him about whatever he was doing so that he was being bombarded with language. While we're on the topic of toys, make sure you have basic toys that allow for many open-ended play opportunities, such as colorful wooden blocks, simple baby dolls, pretend kitchen and food setups, puzzles, and other toys that allow kids to use their imaginations and engage in pretend play. Tip number 4, read to your child often. Reading to your child as often as possible is another great way to elicit language from him. Simply describe the pictures in a book without following the written words. Choose books that have large, colorful pictures that are not too detailed. Ask your child, "What's this?" and encourage naming and pointing to familiar objects in the book. You can also introduce animal sounds to associate a sound with a specific meaning, like the cow says moo. My final tip, tip number 5, is to wait for it. In today's fast-paced world, it's difficult for kids and parents alike to wait it out for anything. We have knowledge and answers literally at our fingertips. However, for a child who is struggling to learn language, we need to be patient and give her a chance to come up with the response herself. So make sure you take time to wait for your child to respond to you. When you ask a question of her, wait. When you ask her to do something, wait. Sometimes we don't realize it, but we're not allowing our children to take part in important learning experiences because we're too busy responding and doing it for them, rather than waiting to see if they can do or see or say it without us. Set up communication temptations for your child who does not typically use words to make requests. For instance, put a desired object in a container that cannot be opened by the child. Hand the container to the child, and when he or she cries, encourage him or her to use the word open, and then to retrieve the object. As frustrating as it is to do this, I can't tell you how many crying meltdowns we went through with our speech-delayed kids. It's exhausting, I know, but well worth it when they start to use words. Waiting it out will force language opportunities for your child. And when she does utter the right word or make an attempt to be verbal, don't forget to praise the heck out of her. When you have a speech-delayed child, you also take on the role of a cheerleader, equally as important as eliciting language. If you feel your child might have a significant delay like mine did, don't delay in seeking an evaluation. Consult with your pediatrician for a recommendation. What do you do in your home to help foster language in your late talker? Share your thoughts in the comments section at quickanddirtytips.com/mighty-mommy or post your ideas on the Mighty Mommy Facebook page. Or you can email me at mommy@quickanddirtytips.com. And don't forget to visit my family-friendly boards at pinterest.com/mightymommyqdt. As always, thanks for listening, and until next time, happy parenting.